Dr. Badejo Olawale, Director of Clinical Services, National Hospital Abuja, says the National Comprehensive Cancer Network (NCCN) guidelines for the management of cancer patients will harmonize cancer treatment. He said this in Abuja at a one-day conference on the uptake of the NCCN harmonized guidelines for sub-Saharan Africa. The conference, organized by the hospital in collaboration with the Ministry of Health and American Cancer Society, focused on breast cancer as the pilot.
Is a situation where people do things from their own perspective. At the end of it all, some people start from the head, some start from the neck, some start from the foot. At the end of it all, there's a lot of confusion. The guideline helps you, irrespective of the amount of resources you have, to practice within a set code, such that if all you have in a center are surgeons and no radiologists, your surgical practice will fall in line, and the patient, if he or she ever has reasons to go to a place where there are facilities, you would not have done harm to that patient. They will just take it off from there. So it's beneficial to the practitioner in terms of guide, it's beneficial to the patient in terms of safety and getting the best possible care in the spectrum of in the care spectrum across the different disease types.
Dr. Uchechukwu Shagaya, Head Radiotherapy and Oncology Department, said that the conference was organized to commemorate the World Cancer Day, which is marked on February 4 every year.
Well, over the years, most people do awareness, and we, the oncologists, surgeons, and doctors who manage breast cancer, decided we should do the bridging of the care gap within the caregivers. So we decided to launch the uptake of the harmonized guidelines. We want to make sure the management of cancer is harmonized, and we're using standardized guidelines. The guideline basically is for specialists, and it talks about way from prevention of cancer all the way to palliation. It talks about the workup, the tests that should be done, how it should be diagnosed, and then how it should be treated, what you expect from the side effects of the treatment, and then the outcome of the treatment, as well as the follow-up of the treatment.
Professor King David Yahweh, convener, University of Abuja Teaching Hospital UATH Multidisciplinary Tumor Board, said with the training, caregivers have been empowered with knowledge to know where help can be obtained.
What we're aiming at this program is to equip all of us who are managing breast and other cancers in one way or the other to be able to know where we can drum up support anytime we need. And that is very important. So you'll find that you don't have to keep a patient waiting in your place for a long time. You can very quickly transfer that patient or refer that patient to where that service is immediately available. That way you'll be able to treat the patients on time and therefore be able to prolong their lives.
Speaking about the brachytherapy machines for the treatment of cancer, inaugurated by the federal government in 5 tertiary hospitals across the country, he said that it was an excellent development.
It's a very innovative, a very futuristic idea from the federal government to have launched that system. It's not yet enough, because we want to see that patients do not have to travel long distances to have this facility administered. But I think it's a step in the right direction. I can tell you, when I became a surgeon, there was only one center in this country offering any form of radiotherapy. About 39 years down the line, I see great hope. I see a lot of innovations. I see even the private sector involved in making available radiotherapy facilities. So